Hi guys, Doc Heps here with UroCoach. So are you someone who has to go to the bathroom all the time, feel handcuffed to the toilet? Maybe you've tried some medications and those squeezing exercises and nothing's working? Well, I've got something you may have not heard of called Sacral Neuromodulation. Stay tuned. Hi, this is Doc Heps with UroCoach, and today I partnered with Medtronic Pelvic Health to talk about something you may have not heard about, a technology called Sacral Neuromodulation, or SNM, which is used to help patients improve their bladder and bowel control problems. So now you might be wondering, how does this all work? Well, the device works in a similar fashion to how a pacemaker for your heart might work, but in this context, the device modulates the nerve signals between your brain, your bowel, and your bladder. And it can help restore the normal function when these signals are disrupted. So who are candidates for sacral neuromodulation? There are really 4 different types of patients. One of which are patients who can't empty their bladder or underactive bladder, urinary retention. The others are more common, those patients with urinary frequency and urgency. Also patients with urinary urgency with urinary incontinence, meaning you're leaking urine. And lastly, those patients who have bowel issues and have fecal incontinence. In general, it's recommended by the professional societies that you try sacral neuromodulation after you may have tried some other types of treatments such as medications or pelvic floor physical therapy. So what are the benefits of SNM? Well, the main reason people are doing this is to improve their urinary function, to allow less trips to the bathroom and fewer incontinence episodes, overall restoring their quality of life. In fact, in one clinical trial, patients with overactive bladder reported a 3 times greater improvement in overall quality of life with the InterStim system compared to medications alone. So what are the risks? Understandably, this therapy is not for everyone, but some of the risks include pain or infection. Sometimes the thin wire that's implanted can move or migrate. Some folks can have just undesirable or uncomfortable changes in their bladder or bowel function, or some uncomfortable stimulation. So how long has sacral neuromodulation been around? Well, SNM isn't the new kid on the block. It's been around since 1997 when it was first approved for urinary incontinence, and then in 2011 when it was approved for fecal incontinence. Since then, over 400,000 patients have been implanted. So remember, bladder and bowel control issues are very common, and many people don't even realize that this sacral neuromodulation SNM technology even exists. So the first step is talk with your doctor. If you're curious about this technology, visit the website talkleaks.com and take the quiz and get started on your pathway to a better quality of life. Again, this is Doc Heps with UroCoach, realurology.com. Appreciate your time and thanks for watching.